If you feel like everyone around you is sick, you may have good reason. Flu season seems to be peaking early in Illinois, with more than 100 more influenza outbreaks across the state this season compared with last season at this time. And the most common strain of flu this year is one associated with more severe symptoms, according to the Illinois Department of Public Health. Last year we saw the peak in February, said Melanie Arnold, spokeswoman for the health department. It might just be starting earlier. The current levels also are higher than most flu seasons since 2009 to 10, state records show. From the start of 2017 through December 31, there were 344 total flu-related intensive care unit admissions across the state, and 135 outbreaks defined as 2 or more cases of the flu in a group setting reporting to the state, and at least one confirmed through testing. Those numbers are much higher than the same intensive care unit admissions and outbreak statistics from the last 2 seasons, 40 and 11 in 2016, 56 and 2 in 2015. In 2014 there was a similar spike, with 497 intensive care unit admissions across the state and 123 outbreaks, according to Health Department statistics. But the year before that, in 2013, there were far fewer, with 216 intensive care unit admissions and 5 outbreaks. Cook County public health officials began seeing an increase in cases in the county's suburbs and at Strager and Provident hospitals in Chicago in December, with the number of emergency room visits above the average in the last 2 weeks, though there has only been 1 death for a person with flu-like symptoms. Doctors believe they may see more flu cases this year than last year, which they called average. The high number of cases prompted state health officials on December 27 to recommend that hospitals limit visitors and put precautions into place aimed at preventing and controlling further spread of the flu. Several hospital systems, including Northwestern Medicine hospitals and the 12 Advocate Healthcare hospitals across Chicagoland and Central Illinois, have done so. The precautions include restricting hospital visits for anyone younger than 18, limiting the number of visitors to 2 per patient, promoting hand washing, and assessing visitors for symptoms of acute respiratory illness and asking them to leave, or at the very least, wear a mask. Cook County public health officials Friday also instituted a screening policy at its hospitals to cut the risk of transmission to already ill people. Effective immediately, visitors will be screened for flu-like symptoms before being allowed to see patients. Children under 12 won't be allowed to visit patients at Strager or Provident hospitals at all. The most common strain of influenza this year is H3N2, which was covered by this year's flu vaccine. While strains can still mutate in individual cases and render the vaccine ineffective for some people, the flu vaccine can also help lessen the severity of illness in some of these cases, said Drive. Robert Citronberg, infectious disease physician with Advocate Healthcare. Health officials do caution that the flu vaccine can take up to 10 days to be effective after it is administered.